This is the Schroth Boss Podcast, a show that helps parents of kids with scoliosis find clarity in their path navigating the scoliosis journey.
You are about to be spoiled. Dr. Katie Blanchard, Schroth Method physical therapist and coach, brings together physical therapists, spine surgeons, and parents to share and discuss tips and tricks for managing scoliosis.
Scoliosis is not easy, but don't worry, we've got your back.
Welcome to another episode of the Schroth Boss Podcast. My name is Dr. Katie Blanchard, Schroth Method physical therapist, and today I'm excited to introduce you to Dr. Arun Hariharan, who is a pediatric orthopedic surgeon with a specialty in pediatric spine surgery. So welcome, Dr. Hariharan. Welcome to the podcast.
Oh, thanks so much for having me. I've been following you on Instagram, got lots of good stuff on there, so glad to be here.
Yeah, Dr. Hariharan is with the Paley Institute in West Palm Beach, Florida. So, Doctor, why don't you tell us a little bit about Paley Institute and how you got interested in treating spine and scoliosis specifically?
Sure. I'll give a brief history. So, I am at the Paley Institute. We're in West Palm Beach, Florida. It's a little paradise on earth, beautiful place. We have over 20 surgeons, about 8 of us do pediatrics, and there's a team of 3 of us that do scoliosis-specific surgeries and treatments for children or the pediatric population. My partners are Dr. David Feldman and Dr. Harry Schuffelberger. Both have significant experience and have been doing this for over 25, 30 years each, and are wonderful folks to work with. So it really is a nice and very special practice. We get lots of local patients. We take care of a lot of our community and our people, but we also get a lot of patients from kind of all over the country and all over the world, which is what makes it so interesting. I mean, we see patients all the way from Australia and Singapore and China, but also right down the street from us here in West Palm Beach. And really, the Institute started as a place for treatment for patients with many congenital or limb differences, but it has grown to be much more. And somewhere in the range of 50 to 70% of our patients come from outside of Florida, and really depends on the pathology and what they're coming to see us for. So we're a big referral center for second, third opinions, things like that. So that's a little bit about us, but my interest really started when I was a third-year resident in Baltimore. When I started my orthopedic residency training, I was going to be a hand surgeon, and that's just what I was interested in. But the more I started spending time with children, the more I started performing and being involved and learning about these spine surgeries, I saw what a significant impact it can have, and especially with children, the resilience and their eagerness to get better and get back to life was really refreshing. And in orthopedics as a general specialty, that's pretty common, but in children it's to a whole new level, and really gives me an appreciation and understanding for what's important in life and what's the future of our treatment plans. And we're not really there to just operate on patients because we can, but we're there to make a difference in the way people grow up and live their lives.
Mm-hmm. Yeah. It's funny where life takes you, and, in your education, being in a medical field, you think you're going down one path, and then all of a sudden you get experience with something and you're like, wow, I need to do that with my life. I need to make an impact here. I have something similar. I started out being a PT. I wanted to do sports medicine, ACL rehab, all of that, because I tore my own ACL back in the day.
Nice.
But I started treating kids and seeing kids with scoliosis, and I was like, oh my God, there's a need for this. And I love working with the kids. And, there's not many people who specialize in treating scoliosis physical therapy wise. And you do see that impact, that happens when they're a child, but it affects their whole life going forward.
Yeah, I couldn't agree with you more. And you're totally right, especially in the Schroth therapy and scoliosis specific therapy field, even in a place like Florida where we have so many of us, it's not an easy thing to come in contact with or try to find somebody that specializes in it. So I've had the good fortune of working with multiple people across the country who are really specialists in this, and glad to connect with you as well. And I don't know if this was true in your line, but for me, it was meeting people along the way, mentors and people who've gone before me that really have made a big impact on what I do and how I do it, and still does. And that's where people like my partners play such a big role.
Mm-hmm. So what other types of mentors have you had that have really influenced your practice, and maybe like your just mindset in approaching treating kids with scoliosis?
Yeah, I think mentorship is a very special thing, and we're really learning more and more about it as even in the last 10 years, as I've gone through my training, the way I think about mentorship and the way we as a medical community think about mentorship has changed. And there's mentors, there's sponsors, there's just friends and teachers. But for me, mentorship started early. It starts with my parents and my siblings and teachers growing up. But really, in the field of orthopedics, as a resident, I had worked with a doctor named Paul Sponseller in Baltimore, who's an absolute legend in the field, and he really had a big impact on how I treat children and what I do, especially in spine surgery with scoliosis. And then through fellowship, there's too many to name, but in my first fellowship, my fellowship director was a guy named Sukin Shah, who was a huge name in the field of orthopedics. And anybody that knows about idiopathic scoliosis or Schroth knows him, and his partner Peter Gabos was another big name there. And then I went to New Zealand for 6 months and spent some time learning really all about scoliosis. And I worked at a pediatric hospital in New Zealand, which is really the only main pediatric hospital for the whole country and for the whole region there. So many of the surrounding islands, and even as far as Indonesia and many like Fiji and all those countries would send their patients there. So it was a great learning opportunity. There's a man named Hamish Crawford over there who's been doing this for a long time. He is very involved in the Orthopedic Society of North America, and now I came, at my old practice, I was in a small private practice, and then I joined the group here, and working with David Feldman and Dr. Schuffelberger have been really great blessings. Their experience can't be understated. You can read and study as much as you want, but there really is no teacher like experience. And if something shows up to clinic, or if something goes wrong in the operating room, they've seen it before and they know how to deal with it. And I love that I can just call or go down the hallway and grab them and have them help me.
Yeah, it's wonderful to have a network of people, that you can rely on, to help you out and to add to your expertise as well. So tell me a little bit about, if a patient walks into your clinic, what is the most typical case that you see scoliosis wise?
Right. The most common thing that I see, and the most common type of scoliosis in the world, is what we call idiopathic scoliosis. And I'm sure that's the most common patient in your line of work as well. And this is the type of scoliosis where we don't really know what caused it. We think there's a genetic predisposition, probably, but kind of shows up in the teenage years, usually picked up by a coach or the pediatrician. Sometimes the patient picks it up themselves. And this is what we call adolescent idiopathic scoliosis. And usually it's a girl. Girls get it much more commonly than boys do. And the common ages of presentation, usually from 9 to 14 years of age. And right when children grow is when this really pops up. And what people notice is either one of their shoulders is higher, or there's a difference in their waistlines, or a lot of times swim coaches and gymnastics coaches pick it up because when they bend forward, you can really see the ribs sticking up. And it's great to have a network, like you said, of not just surgeons, but to know physical therapists and pediatricians and coaches who pick this up and can call you, and we can get them into clinic and get an x-ray and confirm the diagnosis.
Mm-hmm. Yeah, and it's great, to be, on a podcast like this, spreading the word about, scoliosis in general, so that it can be found by those types of people like parents, coaches, earlier than later in life. Because obviously, if you can catch it sooner, that's a little bit better for the long-term, care of that patient with scoliosis.
You are totally right. Again, that really cannot be emphasized enough. And the treatment options completely change if caught early versus late. And I really, it actually complicates it a little bit when it's caught early, because there's so many options for it rather than when it's caught late. But that's a good problem to have, in my opinion. So you're really working with the patient and the therapist and the family to come up with a decision on how to move forward with it, rather than just say, hey, your curve is 100 degrees, you need surgery. And I much prefer the early stages of the scoliosis, so we can avoid that surgery, really.
For sure. And a lot of times, parents coming to see you, they've, their child has been healthy their whole life, active, they don't have any pain. And usually with scoliosis, idiopathic scoliosis, there isn't pain associated with it. But, their child is healthy, and all of a sudden they get this scary diagnosis of scoliosis. They've gotten an x-ray and they're like, oh my gosh, there's this big curve in my child's spine. And there's a lot of panic associated with that. So when these types of parents come into your office, how do you deal, with this just shock of the diagnosis, and how do you, lead them and educate them on, next steps?
You are saying all the right stuff, as that somebody who treats a lot of patients with this kind of thing would say. And the social and emotional impact of it really cannot be spoken about enough. It's very easy as medical providers for us to look at a patient or look at an x-ray and say, hey, you've got scoliosis, this is what you have to do. But there's a child behind that, right? And there's a family behind it, and there's dreams and goals and life aspirations behind it. So my biggest thing is, and I say this all the time in clinic, is you are Abby, or you're John, or you're Dave, or you're Ellie with scoliosis, but the scoliosis is the smallest part of you. It doesn't matter, is what I tell them. Mm-hmm. We have ways to treat it. You can still do whatever you want. You can still be a gymnast. You can still play football. You can still ride roller coasters. You can still swim. You can do all of those things. And we will take care of you to get you to that point, whether it's with just braces and therapy until you're done growing, or if you need surgery, you need surgery. But just because you have surgery doesn't mean you can't do those things. So it really is important to understand there is a human being behind this, and not just an x-ray that we're taking care of. And the scoliosis really is just one tiny part of who the patient is. And there's a whole other world that's there. And in my opinion, in most cases of idiopathic scoliosis, no doors have to be closed.
Yeah, wonderful. And that's, parents and kids themselves are really scared of that. They're scared that, they're not going to be able to play basketball. They're not going to be able to, do gymnastics, or, go to the next level, be a collegiate athlete in the future. Those types of things. And I think it's good to just bring attention to, even if you do have to do bracing, even if you do have to, get a surgery, those things are not off the table. And I think we've seen some good examples of, patients who have, excelled in those types of athletics and, things like that, after surgery even. So what's your experience with that?
Yeah, I completely agree. And the beautiful thing about our field and where we live today in, this super connected world is we are improving daily, and we're improving rapidly daily. So the difference in recovery from when I was a resident to now is huge. And from 20 years to now is even bigger. So patients are, even if you have to have surgery, for example, I'll just use spinal fusion as an example, okay? And that's the most common type of surgery we do for somebody with a severe scoliosis. Even if you have to have a spinal fusion, people are usually in the hospital for 2 to 3 days max. You're walking the next day, you don't wear a brace, You are out of school maybe 2 to 3 weeks, maybe. Some people go back way sooner. And you're out of sports for about 4 to 6 months. But that doesn't mean you're just laying on a couch or bedridden this whole time. But we've made so many advancements that people are literally back to playing tackle football or doing gymnastics by 6 months and have no issues. And people always ask about pain, right? And the immediate post-surgical pain is certainly there, but by usually about 7 to 10 days, people are off of all pain medications and they don't want it anymore. Not because we don't give it to them, they just don't want it. They feel fine. And this is just with fusion surgery, but there's other types of surgeries that I'm sure patients have seen and heard about called vertebral body tethering, which has an even faster recovery. It's a newer procedure, and we don't know as much about it as we do about fusions, especially long-term outcomes, but it's another great option. And then, going back to the simple things like bracing and doing therapy, life really doesn't have to change. If you want to go to swim practice 3 hours a day, it's okay to take that brace off. And you learn the exercise at home and make it a part of your routine. It's good for, lifestyle for your whole life. Even if the scoliosis improves or doesn't worsen and you never need surgery, it's a good skill to have.
Definitely. Yeah. Well, this is great. I think you've provided a lot of good information on, scoliosis in general, just making parents a little bit more comfortable with the diagnosis and what the journey looks like of, from diagnosis to conservative care to surgery. So is there anything that you wish I would have asked you about that you may be passionate about or that you want to touch on that I haven't covered for you?
No, we've hit most of it. I think what I would leave this with is, encouragement for your child is important. Really understand that because you have scoliosis doesn't mean life changes or is different. And one other big point I always like to talk about is just like you would not trust, for example, an accountant to do your surgery or somebody not specialized in a field to take care of your child for any given reason. Really seek out care from people who are specialized in what they do, like you with your Schroth certification. You want to go to somebody who does what they do on a daily basis, and you want to go to a pediatric orthopedic surgeon. You want to go to a brace maker that makes pediatric scoliosis braces. You want to go to a therapist that is trained in scoliosis specific therapies. And again, we live in a world where that is so easy to do, and it is so easy to call someone or Zoom with someone or consult with someone to get opinions. And it's okay to get multiple opinions, and it doesn't hurt our feelings. It's good for your child. And I think many of us would do the same thing. So reach out, and we're here. And that's about it. I think you're doing great work, and thanks for all your advocacy for our patients.
Yeah, it's definitely okay to get that second, third, fourth opinion, and if you come across somebody you're not comfortable with, you're like, I'm on the fence, go get that other opinion, come talk to Dr. Hariharan here. How can patients connect with you? I know you guys do some virtual consults. Can you expand a little bit on that before we leave it to it?
Yeah, we do lots of virtual consults. Like I said, we have many patients that come from out of the state, out of the country. We have lots of resources for patients to come visit us and stay with us. But the easiest way is to go on the website and send me an email, and we'll set up a Zoom meeting, and we'll have you upload your x-rays onto our website, which is super easy to do, and we can chat. And we're happy to help. We have a big team that does this on a daily basis. So it's a very seamless and easy process, and we're here for you. Email me anytime.
Awesome. I will put Dr. Hariharan's information and how to connect in the show comments and wherever we post this podcast, so that you can all get in touch with him. So thank you so much, Dr. Hariharan. It's been wonderful chatting with you. And so everyone listening, we hope to see you in the next show. Thank you.
Thanks, Katie. You're quite the Schroth boss. Love it.
Thank you.
Thanks for listening to the Schroth Boss Podcast.
Want more info on scoliosis and the Schroth method?
Join our free Facebook group or connect with us at schrothboss.com.
See you at the next episode.